My journey with myeloma, and the reason probably that I'm here today, is because my father has multiple myeloma, and he's here, Patrick Taylor. So I couldn't say no when I was asked to talk. And I don't normally give talks like this. I'm more of a clinician. I work with people, I run groups, and I love doing that. It's my passion. But I felt like it was important to do this talk today, and it's really from the heart. So, yeah, I'm getting teary. So I wanted to ask, first of all, how many of you have heard a little bit about mindfulness? Okay, so most of you, and some of you, have people never heard about mindfulness? Are there some people who don't know about this at all? Okay, maybe a couple. All right, okay. And are there any people here who have a mindfulness practice already? Okay, not so much. All right, okay, great. Well, that's nice. It's nice to have a fresh audience. So we'll go with that. All right, so let's go to the next slide. I'm just going to go over the outline of the talk today. So I want to talk a little bit about who can practice mindfulness. And sometimes there's some misconceptions around this. There's been a lot of media hype lately about mindfulness. And a lot of it is about some of the positive findings in the research, but a lot of it is also a bit misconstruing things. And so I want to help us get clear about what mindfulness is, who can practice it, how it works, and what it's actually useful for. So we'll cover some of the clinical research, some of the neuroscience, some of the what you could call adverse effects of mindfulness or challenges, and how to find good quality mindfulness resources. I wanted to check, is there anything else that people would like to know about that is not on this list? Just so I make a mental note. No? Okay. If it comes, we can do it as questions. Yeah. That's the next slide. All right, so the top 5 myths of mindfulness. Myth number 1 is we see a lot of pictures like this in the media these days. So we get the idea that mindfulness is practiced by slim young women, and they're usually white. All right? This is not the case, and I want to debunk it right away, because it really makes a lot of people think, well, this is clearly not for me. So let's go to the next slide. So if you look at the picture on the top left, that's much more typical of what a mindfulness group that I run looks like. I have people who range from age probably 20 up to 80, so huge range of different ages, people from every background under the sun. My current group has, I think, like people from 9 different countries. It's incredible. And every sort of condition. So it's really something that can help a wide range of people. We also see, oh, now the mic's working. What just happened? Okay. We also see mindfulness being taught in schools, in prisons, in hospital settings. So it's really being found to be helpful in a wide variety of situations and settings. All right, myth number 2. Mindfulness must be practiced sitting on the floor with legs crossed. Now, the reason I put this in is because I remember when my father was diagnosed with myeloma, and we started talking about mindfulness at that time, and I was already, practicing and running groups, and he was quite skeptical about the whole thing, and he said, I definitely can't do that because I can't sit on the floor. And I said, well, it doesn't have to be that you're sitting on the floor. So I get this in my groups a lot too. People come and they think they have to sit on the floor, so I put chairs out and I say, please use the chairs. Chairs are welcome, it's not a problem. So we'll go to the next slide. So there's a variety of postures that we can use for practicing mindfulness. Sitting on the floor with your legs crossed is one of them, but sitting on a chair is another. And usually if we're using a chair, we sit with both feet solidly planted on the ground, so you may need to put a cushion under your feet if you're a little bit shorter. You may want a cushion behind your back to give you a little extra support so you can sit nice and tall. You want to have a nice tall posture so you can breathe comfortably. You can practice kneeling. So there's stools you can get that help to practice kneeling, which can be easier for some people's backs. You can also practice lying down. So for people who have physical health issues, fatigue, if you're really struggling and you're in the middle of treatments, for example, and you think, wow, I can't do this because I'm too tired, you can do a lying down practice. So sometimes there is a risk, which is falling asleep, and that does happen. Sometimes people do this kind of practice in my groups, and sometimes they snore. We try not to let that happen. But it's a very valid and reasonable option, and I sometimes do my practice lying down if I have back pain or something like that. So it's completely acceptable. Standing, another one. So how often are we standing in the day, right? Waiting in line at the ATM, waiting in line at the grocery store. Perfect opportunities to practice mindfulness. So absolutely you can practice standing and also walking. And these are traditional parts of the mindfulness practice and teaching. So it's not just about sitting, like this. All right, next slide. All right, myth number 3 is that mindfulness is a panacea for all ills. And we get a lot of this now in the media that everything can be cured with mindfulness. And that's just not the case. First of all, the research is quite early and preliminary. And there are a lot of things that can't be treated. But that said, there's a lot of things that really improve with mindfulness, especially in terms of our quality of life. So I want to go over what it can do. And some of that will be just generally, and some of it will be cancer specific. So what we do know is that there are mild to moderate, since when I turn this way, it goes mild to moderate results equivalent to other medical treatments for a variety of conditions here. So age-related decline in attention, that gets better with mindfulness practice. We have less of that happening. We see decreased levels of anxiety, decreases in depressive symptoms, decreases in self-reported stress, so people feel less stressed out. And there is some research, there's some conflicting evidence about it, that we also see decreases in biologic markers of stress, so things like cortisol and immunologic markers, which is important for how our immune system is functioning. And in our recovery, that can be very important. We see reductions in chronic pain, and that again is something important for myeloma because a lot of the time people are dealing with pain issues. And we'll kind of come to that a little bit more later. And we see reductions in substance use and cravings for those who have addictions. So that's sort of generally what we know. And then I'm going to go over in the cancer research around mindfulness a little bit more in detail. I couldn't find any studies on multiple myeloma and mindfulness. So there's a big gap there. So what I've had to do is look at a lot of the research that's been done in breast cancer patients. That's where it seems to have been most studied. So we've got 2 meta-analyses, and a meta-analysis is where they combine all of the different studies that have been done together and look at the results collectively. So 2 meta-analyses of breast cancer looking at mindfulness interventions' impact on stress and anxiety levels, and they saw a large effect size, so big reductions in stress and anxiety levels. And this is important because a cancer diagnosis is stressful, right? There's nobody, I think, who's going to be just breezing through. It really is something that kind of shatters our worldview. It shatters our sense of our future, our sense of what's going to happen to us and who we are. And that is very disruptive and can create a lot of anxiety. So this is a very important thing for quality of life when we're dealing with diagnoses of cancer. So we also see, these are 9 studies, different designs, looking again in a breast cancer population and focusing on depression this time. And smaller effect size there, but still a significant effect in reducing depression symptoms. And clinically, that's what I've seen, is that people who have anxiety and stress tend to respond really well with mindfulness practice. People who have a heavy depression, sometimes a little bit more resistant. Mild depression often do really well. Heavy depression is harder, they may need extra support. So 3 randomized control trials were done on all kinds of cancer. So those are very good study designs. Some of the research in mindfulness is not good study designs, I'll be honest. They're trying to figure out how to study it still. It's not an easy thing to study. How do you randomize a mindfulness practice? Or how do you control it properly? You certainly can't do it in a blind way. How do you measure mindfulness? Do you measure how people feel afterwards? Do you actually have a measurement of mindfulness? So these are some of the struggles with the research that are ongoing. But these are good quality studies, and they focused on all kinds of cancer, looking at anxiety, and there was a medium effect size, which is significant. And what they've generally found is that the mindfulness practice is about equivalent to SSRIs, antidepressants, or anti-anxiety medication. So that's quite significant. And I'm just going to skip the last one because it mishmashes a lot of information together, which isn't very helpful. So a few studies that were particularly interesting that I'd like to highlight. One big one, they did 270 patients with breast cancer. So it's a large study, and they did a mindfulness-based cancer recovery program. That's what MBCR stands for, versus a supportive expressive therapy group. And they found more improvement in stress symptoms, mood, quality of life, social support, spirituality, and benefit finding. So that's a lot of very positive changes that people had from doing this group. And this was maintained for a year. So in a year of follow-up, those positive changes were maintained. So that's quite significant. Another study looking at prostate cancer, and they did MBSR, so that's mindfulness-based stress reduction, a different mindfulness intervention, 8 weeks program, and they found, again, decrease in cancer-related anxiety specifically, so anxiety related to the cancer diagnosis or related to recurrence of cancer, and improvements in global quality of life. And that was also sustained over 12 months. And then the last one I include is quite interesting because it was an online mindfulness-based program. So for people who are living in remote communities and who don't have access to these kinds of resources, this can be very helpful. And they found, again, a medium effect size on mood, stress symptoms, and spirituality. So improvements in all of those areas. So that's quite exciting research and quite promising. So just to summarize the findings with mindfulness interventions this is in breast cancer, which is, again, where most of the research has been done. There is a reduction in negative symptoms, so depressive states, anxiety states, those kinds of things, stress. We see an increase and a gain in positive psychological states, so feelings of well-being, kindness towards oneself, so having a sense of kindness in our relationship to self, greater sense of meaning and purpose. They call this, actually, there's a term, post-traumatic growth. So when you have trauma, which a diagnosis that's life-threatening can be, for some people it later can become an opening into a sense of personal growth and deeper sense of meaning in life. So they're seeing increases in that. And some beneficial effects on specific physical symptoms, so fatigue in particular is one, and mixed results on pain, insomnia, and some of the other cancer-related symptoms. So we'll come back to that again a little bit later. You know, one of the things that we can find when we're dealing with physical symptoms is that often we have the physical, let's say, pain, and then we have our resistance to the pain, the not wanting to have it, right? And the mind's reaction to the pain. I don't want this to be here. Life is miserable. This sucks. And then we get really even more miserable, right? It's like a spiral. And so the mindfulness practice helps us to keep it to just the pain, right? Okay, so I'm experiencing pain now, and not getting so much into the resistance to it. So there's a saying that suffering equals pain times resistance. And so if we take out the resistance, then we have a little bit less suffering happening. And the last thing is that there's some promising studies, but this is still new, looking at inflammation and genomic markers and sort of biologic markers of stress, and there seem to be reductions in inflammatory markers and in stress markers. So that's promising. So last thing about cancer research is that in the latest clinical practice guidelines put out by the American Cancer Society, mindfulness meditation was given grade A evidence, that's the top evidence, as an intervention for depression, anxiety, and improving quality of life in people with cancer. So that's pretty significant. All right. So let's get to myth number 4. Actually, before I do that, any questions so far? Yeah?
You mentioned in the last biological stress marker.
Yeah, so that's like cortisol. Oh, the question was that I had mentioned biological stress markers. So, for example, cortisol is one, and when we're stressed, more cortisol is released, and our cycle of cortisol release can be disrupted, so it's a cyclical hormone. And so they've found that, at least in some of the studies, people's cortisol levels have dropped when they're doing the mindfulness practice. Yeah. Okay. So I like this cartoon. It says, "We found this in your brain." There's a little monkey. So, you know, traditionally they talk about, in the yogic tradition, they talk about the monkey mind. Have people heard of that before? Yeah? And actually, it's not just that we have a monkey mind. Some of the teachers will say we have a monkey mind that's drunk and was bitten by a scorpion. Like that's, and this is the normal human mind, right? So often we think, well, my mind is not suitable for mindfulness because it's just too crazy. But actually, this is the nature of the human mind. We're just all having these crazy monkey minds jumping around. And if people haven't seen monkeys before, you know, they're very active. They're kind of like the raccoons, you know, they're like grabbing at things and scurrying around and fighting and snarling. So it's a nice metaphor to think of. That's why I called my group Minding Your Inner Monkey. And a lot of people can relate to that. So I'm going to go through a little bit of debunking why having a monkey mind does not exclude you from practicing mindfulness. Actually, before we get to that. So before I do that, I want to ask people, I haven't defined mindfulness yet. Do people have a sense of what it is? Can I hear any thoughts about what is this mindfulness thing we've been hearing about? Yeah?
Just being aware, certain awareness of being in the moment.
Yeah, so being aware in the moment. Yeah, good. Anything else? More present? Yep. Yep, great. Anything else?
Focusing on what is happening inside, so you're breathing, where you are, how your body is reacting to where you're sitting.
Yeah. Yeah, so focusing on our internal experience, being more aware of what our internal experience is like. Good. Yeah. Sorry? Transcendental meditation? It's a little bit different, actually. It's a little bit different. Transcendental meditation is a different kind of meditation practice. So maybe as I explain, we'll see a little bit the difference between the two as we go. Yeah. Okay, so let's go to the definition. So this is the definition given by Jon Kabat-Zinn, who's sort of the founder of modern secular mindfulness practices. He did a lot of the research. He established the MBSR, mindfulness-based stress reduction programs, and kind of popularized it. So he calls mindfulness, he defines it like this. Mindfulness means paying attention in a particular way, on purpose, in the present, non-judgmentally. So that's kind of a lot to make sense of. But there's an important piece that is added in this that we didn't get as we were just brainstorming, which is the non-judgmental part. And it's about exploring our present moment experience, being open to it and watching it without judging it, without sort of getting involved in it. And that's a skill that takes some practice. Most people will not be able to do that in the beginning, but we train our minds. So we end up training our capacity for attention, and then we train our capacity to observe experience in a different way rather than getting involved in it. And sometimes what we're observing is that our mind is really judgmental, right? So sometimes we just get this deep understanding that, wow, my mind is constantly judging things. It's judging other people, it's judging myself, it's having all of this confusion, and we just start to gain awareness of, wow, that's the nature of my mind. And so we start to hold this kind of open, more spacious awareness of what our internal process is like. So let's try a little practice together, and then we can see how that goes. So I'm going to invite you all to bring your feet firmly onto the floor. And you might want to try sitting a little bit forward and bringing your spine nice and long. If you have pain or anything like that, don't worry about it. And you could gently close your eyes just to minimize outside distractions for a few moments. And start by maybe just hearing sounds in the room. Noticing maybe the vent or other sounds that you're hearing. Noticing sounds inside your head. So noticing what's going on in my mind right now. What's the flavor, the mood of my mind? Is it relaxed? Is it agitated? Is it jumping around? Is it sleepy? So just getting a sense of the mood of your mind at this moment. And you might also notice what's happening with your breath right now. Noticing if the breath feels deep or shallow, if it's fast or slow. You might notice if there are any sensations in your body. So just bringing awareness to perhaps the touch of your feet against the floor or inside your shoes. Feeling your spine against the chair or the chair supporting the weight of your body. You might notice other sensations more internally. There might be an ache in your neck or a temperature. And then just bringing your awareness from that to the breath. And we're going to use the breath as an anchor to hold our attention. And just feeling the breath moving in and out. You can feel it either in your abdomen or at the tip of your nose around the nostrils. Just noticing the breath flowing in and flowing out. You might see if you can catch and notice the first moment of your inhale and the first moment of your exhale. And you might try and notice the last moment of your inhale, the last moment of your exhale. And if you notice your mind has wandered, just gently bring it back to the breath. Allow your thoughts to pass like clouds pass in the sky. So just allow the thoughts to go and gently bring yourself back to the breath. And just feeling breath going in and breath going out. You might notice the temperature of the breath or changes to the breath as you stay with it. And maybe now allowing sound back into your awareness. Allowing a little bit of light back in, slowly opening your eyes. And coming back into the room. Okay, so I want to ask you guys, what did you notice doing this exercise? What happened, or anything that you noticed? Mm-hmm. You started feeling more relaxed. Okay, great. Mm-hmm. Anyone have similar or different? Yeah?
I was getting distracted and thinking of the hockey game.
So you're thinking about the hockey game. Okay, so you notice distraction. That's good awareness. Yeah, great. Yeah. Anyone else? Mm-hmm.
I was connecting my breathing here to breathing in another place when I swim.
Okay. So the mind was making associations and it was kind of following that a bit with the breath. Okay.
When I was breathing, I, like you said, concentrate on your last breath.
Mm-hmm.
When I was doing that, I had a pain in my back with the discomfort kind of, I forgot about it. So
Okay, interesting. So by concentrating on something else, the discomfort just disappeared. Okay, great. Anything else? Similar or different experiences? How about this side of the room? This is the quiet side. Okay. Yeah?
Well, I noticed that just as noticing my breathing, that I was already breathing more deeply than just before,
Mm-hmm.
and it just continued as the exercise went on.
Mm-hmm.
I wasn't trying necessarily to make it deeper, but it just kept on getting more relaxed and deeper on its own, being still.
Yeah. So that often happens, but not always. So for some people, they'll settle in with the breath some days and not others, right? And just bringing awareness to the breath itself can help us to relax, because the breath activates our relaxation response in the body. So having a deeper breath will activate the parasympathetic nervous system and we go into relaxation. For some people, it can be the opposite, right? And things are like, no way I want to be here and now, I'm just going to go think about everything else. Could anyone relate to that? That happens to me sometimes, right? Yeah. So it can be quite a range of different experiences that people have, and there's no right or wrong about it. And we'll go into the neuroscience now a little bit of how it works, which helps to explain really why there's no right or wrong about it. It's just how it is. So let's go to the next slide. So there's a few things we're doing with this practice, and one of them is training our attention. So we see improvements in attention with the mindfulness practice because we keep wandering and coming back. And the way that this works is, it's really amazing, actually. So the brain is made up of trillions of electrical circuits. In fact, the connections between the cells in our nervous system are more than the stars in the universe. Like, that's how complex these networks are in our nervous system. And the electrical circuits are what make us have, or a reflection of our thought patterns, our movement patterns. Every time we blink, every time our stomach growls, every time our heart rate changes, every little thing that's happening in our body will be reflected by changes happening in our nervous system and firing of these electrical circuits. So if we go to the next slide. Our nervous system, these electrical circuits are made up of cells called neurons. So this is a neuron. And neurons have at their end, at both ends, these little projections. And so at this end, they're called dendrites. And when you think about a baby, if anyone's ever looked into the eyes of a baby and you see them kind of looking around and it's like there's a lot of space there and not much action going on, that's because they don't have a lot of connections between their cells yet. There's a lot of, literally, there's a lot of space there. But when we have a thought or we experience something in a pattern repeatedly, we grow denser connections between the cells in our brain. And so the more often we have a particular thought, the denser the connections get, the easier it is to have that thought again. We strengthen those electrical circuits. And this is a useful and adaptive thing for things like driving a car, so we can drive without thinking about every little step that we're taking, or riding a bicycle, right? But it's not so helpful if we have a pattern of thinking really negative thoughts about ourselves, or if we have a pattern of really getting scared and feeling a lot of fear, then it doesn't help us so much. So I use a metaphor to kind of understand this a bit more, and it's one that only works in Canada. When I go overseas, I have to come up with a different one. But it's about snow. So if you think about in the winter on a snowy day, and it's just freshly snowed, and you open your door and it's like up to here. Okay, it doesn't happen that often, but let's pretend. Deep snow. And you want to go get your shovel, which is in the garage or something like that, and you have to walk through this deep snow. And it's not so easy, right? Like you have to take these big steps, and you're like sinking down, and it's really difficult to take those steps the first time. And then when you come back, maybe you put your feet in the same spots where you were before, and it's a little bit easier, right? And then after a few times going back and forth, there's a pathway created. And once that pathway is created, you automatically walk on that path, right? You don't think, oh, I'm just going to go walk in the deep snow again. You've got a path. And that's what happens in our brain. So the more often we have a thought, the stronger that pathway gets, and the easier it is to have that thought again. And we don't actually think it's possible to have other thoughts or other ways of seeing the world. So with the mindfulness practice, we're actually training ourselves to create new pathways in the snow, new pathways in our brain, and those are pathways that bring us to our present moment experience. So that's how we're changing the shape of the brain. Literally, it's neuroplasticity, and you can see on the neuroimaging studies and the research now how the brain's shape actually changes, and different parts of the brain get smaller and other parts get bigger as we retrain our brain. So any questions about that so far? Uh-huh.
I was just wondering whether in a stroke victim, is it an interruption in these electrical circuits that, for example, I have a friend who had a stroke and it apparently impacted her ability to speak. So now she can find words, but they don't make any sense, so it's kind of random words. And I was wondering if it's the interruption of these pathways or circuits that causes that incapacity.
Yeah. So the question was, in a stroke, is it the same process where the pathways in the brain get disrupted by the stroke? And yes, that is what happens. There's different kinds of strokes, but certain parts of the brain are responsible for speech and language, and so those parts of the brain get disrupted in a stroke, and then we can't produce speech in our normal way. Yeah.
But because of the plasticity of the brain, some other part might now compensate for what normally would be the speech center of the brain. Is that correct? Or is it that original speech center that kind of regenerates itself?
That's a good question. It would probably depend on the particular case and how much damage there's been, and what is done for rehab, and it's a bit complex. It's not always a direct thing. Yeah, thank you. Okay, so this is an example of mindfulness in action. It's pretty typical, and I want to draw out what is pretty normal of what our minds do most of the time, including while we're doing our mindfulness practice. And I call this process selfing. Okay, I got this from another teacher. His name is Michael Stone, and he used to talk about this. So say that this point here is our present moment awareness of the breath. Okay, so we're breathing in, breathing out, we're aware of the breath, and then all of a sudden, oh God, I really ate too much rice for lunch today. I'm feeling kind of nauseous. Why did I do that? Such an idiot. I always overeat. I've got to really deal with this problem, this food problem I have. It's It's never going to end. I've been doing it since I was a kid. Well, oh, wait a minute. I'm supposed to be focusing on my breath. Okay, breathing in, breathing out, breathing in, breathing out. That ache in my back, it's really getting to me. I think it's because I carried those groceries. I shouldn't have been carrying the groceries. My husband should have done it. What was he thinking? Why wasn't he there for me? It's all hopeless. I'm never going to get better in this relationship. I should probably just leave. Oh, wait. I'm supposed to be focusing on my breath. Breathing in, breathing out. Oh, that was a really great song on the radio this morning. I really enjoyed that. Oh, wait, breath. Breathing in, breathing out. So, does this look familiar? Yeah. This is what I call selfing. So, there's a part of the brain that's actually responsible for a lot of this process. It's called the default mode. It's not one part. In fact, it's a network of cells. And it's the part of the brain that's active when we're daydreaming and when we're just kind of thinking about ourselves. It doesn't get activated when we're concentrated on a task. So there's like a tandem thing that happens. So when we're focused, it goes off. But when we're not focused, then this gets activated. And it's usually not very happy thoughts or pleasant thoughts. And it's always self-referential. And so we go into this selfing process, and it creates more suffering for ourselves. Yeah?
I call him the mini terrorist in my mind.
The mini terrorist in your mind. Yeah.
And he's so negative.
Yeah.
You
Yeah.
notice it's a he.
It's a he. Yeah, right. Yeah, and this is our inner best friend, right? Like, yeah. So we can have these interesting things happening. Yeah, John?
I guess a lot of us feel that everyone's even worse though on steroids.
Yeah, absolutely.
You get that manic feeling, it's the same part of the brain.
Mm-hmm.
But being able to focus and calming the brain is that much more difficult.
Yeah, absolutely. So the comment was that when if you're taking steroids as part of your treatment, that it can make this even worse, and that's very true. Yeah. And so when we're doing our mindfulness practice, part of what we're doing is learning how to have a different relationship to our thoughts. Because most of the time we take our thoughts really seriously. Like we think that they're true, right? Everything that our mind comes up with, it must be true. But then we realize if we keep watching that actually, 5 minutes later we're going to have a different thought that's going to contradict the other thought we had. And it's not inherently true. It was just what we were thinking in that moment. So we start to kind of loosen our grip on our belief in our thoughts, and they don't necessarily feel as true or as impactful anymore, if that makes sense. Does that make sense to people? This is kind of maybe a new concept. Because what we're starting to do is to watch the process of the mind rather than the content of the mind. And that's what I talk about here. So we're training our attention, that's one part of it. So we keep bringing ourselves back to the present moment, which could be awareness of the breath, or it could be awareness in the body. So that's the training of attention. And then we're gaining insight into the actual nature of this whole body-mind mechanism. And that's where we watch the process. So we see like, okay, wow, when I take that medication, it creates this effect, and my mind gets more agitated, and then eventually it settles down when the medication dose is reduced, and eventually it stops. So we can start to see that there's these interesting processes that are happening, and that sometimes thoughts come and go, and sometimes emotions come and go, but things aren't as constant as we imagine them to be. So when we're selfing, we have this very clear, constant narrative of who we think we are, right? I was born at this time, my name is such and such, this is my background, this is my history, this is my narrative. And what we start to see as we practice mindfulness is that it's not quite as solid a narrative as we think it is. That actually things are constantly changing, and we start to see all these unconscious processes that have been happening that we didn't know about even before. And we go, wow, I used to think I was a really nice person. I'm not so sure about that anymore, right? We develop a lot more insight into our own behaviors when we watch it carefully, and a lot more compassion. So I'll kind of come to that later. But so we practice monitoring our experience, paying attention to our experience, and we gain insight into the nature of how our body-mind works. We take it less personally. And we learn to accept our inner experience as it is. And this might be a difficult concept again. So oftentimes we'll have an inner experience, like we'll have certain thoughts or emotions, and we really don't like them, right? Has everyone had that experience? I do not want to be feeling this way. I do not want that thought to be there. Make it go away. I'm going to get rid of it. And that's how we react. But with the practice, we're actually learning how to accept our inner experience and not take it so personally. And when we do that, we can even have compassion for ourselves. We can say, oh wow, that's really tough. It's tough to be having this experience that's really painful and not wanting to have it. Gosh, I can hold that with kind of a sense of care for myself. And then we can actually have compassion for others too. And when we're not constantly trying to push away our experiences, then we can also make really good decisions about what we want to do in this particular situation instead of reacting impulsively and just doing something and regretting it later. So it gives us a bit more of a balanced mind about how we're taking decisions and moving through life. Does that make a little sense? Yeah? So I'm going to tell a story that hopefully will illustrate this a bit more. I tell this story in my groups, and it's a traditional story from China. And it's about a farmer who lives in a village. Okay, and he's a subsistence farmer. He lives off of what he grows, and he has a son and he has a horse, and they work together to manage their farm. And so they're plowing the fields, right? The horse is there helping to plow the fields. And one day the horse escapes and runs away. Now, small village, lots of nosy neighbors there. Everybody's talking, na 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 na. And the closest nosy neighbor comes running over and he says, oh my God, what bad fortune you have. This is terrible. You lost your horse. How are you going to manage? And the farmer says, well, good or bad, I don't know. We shall see. And, he recognizes that he's going to have to work a little bit harder now because he doesn't have the horse. So he and his son start plowing the land themselves. They're taking care of the land and doing their thing. And a few days later, all of a sudden, his horse has made friends and come back with 5 wild horses. So now they have 6 horses. So they're like, wow, and the wealthiest people in the village suddenly. And of course, word gets out in the village, everybody's talking, and the nosy neighbor comes running over and he says, oh my God, what good fortune you have. I can't believe it. You're so lucky. We don't have this. And look, you've got 6 horses now. Your life is made. And the farmer says, well, good or bad, I don't know. We shall see. And, he recognizes now he has 5 horses he has to train. So he starts to train his horses, and his son is riding them, and they're teaching the horses how to do the plowing and everything. And life is carrying on. And one day the son is riding the horse, and he gets thrown off the horse. He gets a really bad fracture in his leg. And, he's in a cast. So word gets out in the village, everybody's talking, nosy neighbor hears about it, he comes running over and he says, oh my goodness, such bad fortune. I'm so sorry for you. This is terrible. You've lost your son's health. How are you going to manage all by yourself? So the farmer says, well, good or bad, I don't know. We shall see. And so he starts working really hard again, doing all the work with the horses by himself and plowing the fields. And soon they find out that the Chinese military, the army, is coming through and they're conscripting all the young men from the village and taking them to the army. So they get to his house and they see his son, and he's lying there in a cast and can't do anything. And they say, oh, this boy is useless. We're going to pass on. So word gets out in the village. Then the nosy neighbor comes running, my God, what good fortune. We've lost all our sons and yours has been spared. So the farmer says, no, we shall see. Yeah. So this is a really nice story to kind of help us understand a bit more about the practice. I'd love to hear what you take from this story, and then we can sort of discuss from there. Mm-hmm.
I've also read your book and your page. It's sort of like your window of tolerance,
Mm-hmm.
and it's what you can accept and deal with on like a calm level.
Okay.
thing, so it is what it is what it is, right? I'll just deal with it.
Yeah, so the comment was, it's about accepting what is and we'll just deal with it, and reference to the window of tolerance, which is a little bit different. We'll come to that later, but yeah, trying to make the connections, that's good. Mm-hmm.
Well, it seems to me that the farmer could have been distracted by every comment made by the nosy neighbor and kind of drawn off on that path,
Mm-hmm.
but he wasn't.
Uh-huh.
You know, each time the neighbor said this is bad fortune, he said, well, we'll see what it is, or this is good fortune, well, we'll see.
Mm-hmm.
But he wasn't, pulled away from his own path.
Yeah, good. So the comment was that the farmer was not pulled away by the comments of the nosy neighbor who kept coming and, saying this is good, this is bad. He sort of stayed on his own path. Yeah.
Sometimes when your brain, those thoughts can do to you, pull you off your path or what you're trying to do if you give them too much credence, too much.
Yeah. So the comment was that sometimes your thoughts, if you give your thoughts too much credence, then they can pull you off your path and take you off in a direction you don't want to go. Absolutely. Mm-hmm.
So connecting to what you just said, it sounds like we're selfing. And the nosy neighbor is the selfing that we do, and then we have to go back to this.
Yes. Yes, exactly. So the comment was that the nosy neighbor is like that process of selfing, and that the farmer is that coming back to ourself. Absolutely. Very good. Yeah, good insights. Yeah. Anything else? Mm-hmm.
It's about perspective.
Mm-hmm.
So it's good or bad depends on where we are looking.
Mm-hmm. Absolutely. So it's about perspective, and whether something's good or bad depends on how you're looking at it. Absolutely. So, yeah, one more.
Yes, the farmer didn't get anxious or depressed or from what the nosy neighbor was saying. He just said, oh, well, we'll just have to handle it or see what happens.
Mm-hmm. Yeah. So the farmer did not get depressed or anxious and get completely drawn into the nosy neighbor's stories. He just sort of focused on staying centered. And good. So you guys, I think, got it. In fact, more so than most groups. And the other thing that's interesting is that the farmer also, he didn't just kind of collapse in a puddle and then do nothing. He took action, right? He dealt with the situation. So he said, all right, this is the way it is. Let's see what I can do about it. And this is, yeah, Dave?
Yeah, I think there could be a parallel for those of us who have a myeloma journey.
Mm-hmm.
We have ups and downs. You might, relapse, for example. And how do we respond to it?
Mm-hmm. Absolutely. So the comment was that this can be similar or parallel to the journey with myeloma, and that there can be ups and downs, and for example, relapse, and thinking about how do we respond to it. Yeah, thank you. Exactly. And so we can learn how to maybe accept the situation as it is and still take steps towards our health. And this is very important for things like dealing with pain, dealing with relapse, dealing with other symptoms that may come with a diagnosis. So if our mind is kind of going like this, then we can't always think clearly to make decisions about asking for what we need or even knowing what we need in a particular moment. But when we can come back to our center, it's easier to say, okay, I feel like the pain is kind of creeping up. I better get some better pain management going on now, right? Mm-hmm.
I was going to say with multiple myeloma, there's always a new normal that you have to get used to.
Uh-huh. So the comment was that there's always a new normal that you have to get used to with multiple myeloma. Absolutely. Yeah, so there can be huge pieces of news that come that change everything, right? And then how do you adapt to that? Yeah, exactly. Yeah, good. So let's go to the next slide. So I want to just explain a little bit more about how it works, not too much. So where's my, thank you. So there's a few mechanisms that they found about how this works, and you can kind of get a sense of, it's about the attitude that we're holding, but how does that work in the brain? Well, this area here, the insula, is responsible for our ability to have awareness of our internal body sensations. And people might think, well, who cares about our internal body sensations? But it's actually very helpful because when we can feel what's happening in our body, we can actually feel our emotions better. We can know how we're feeling. We can know when fear is coming up. We can know when sadness is coming. A lot of the time when we can't feel our body, we actually don't know what our emotions are. And so it helps us to become more aware of that. And when we're more aware of that, then we can respond in a more skillful way to our situation rather than just reacting. And it can also help us to understand other people around us because when we can feel ourselves better, we can feel and empathize with other people better as well. So that's one of the mechanisms. And this part, the insula, actually thickens with the mindfulness practice. Another important structure is the amygdala here. So here we go, this little one. And that's like our brain's alarm system. So people may have heard about this. It activates our fight or flight response in conjunction with some of the other structures in here. So whenever we experience fear or anger, this part is like a little siren. It goes bing, and then everything gets activated. Adrenaline is coursing through our body, and stress is happening. We feel it in the form of, well, you guys can probably tell me. What do you feel in your body when you're stressed and feeling fear?
Tense.
Tense, yeah. Tense, breathing maybe, getting heart rate increases, blood pressure increases, muscle tension. We may have gut symptoms, running to the bathroom or not going to the bathroom, clammy hands, right? So the amygdala is our activation point for all of that. And it actually, when we have a lot of fear and people who've had a lot of trauma experiences, their amygdalas tend to be bigger, and it's like it's overreacting to everything. And that can happen to us when we've had, so a cancer diagnosis can be a kind of trauma, right? It's something where it's like we do feel our life is threatened. And so then going back to the hospital, for example, can trigger a whole stress response and stress reaction because our amygdala has become sensitized to those particular cues. Now, the thing with the mindfulness practice is that it helps us to experience those stress responses, but then to bring in our prefrontal cortex, which is this part here, which is our rational thinking mind that can plan and use language and things like this. The amygdala does not do that. It's just like, let's get ready to fight the wild animal or run out of here. But the prefrontal cortex is our chief executive officer. So we can engage that and use that to distinguish, all right, is this actually something I need to be scared of or is it not? And we get an increase in connections between these two parts of the brain through the mindfulness practice. And we learn how to kind of better modulate our responses to fear so we don't have to go into the extremes. Because oftentimes what we're actually doing is like, there's a stuffed dog down there. I've been bitten by a dog before. I see the stuffed dog. My amygdala gets activated. Just one moment. And before I even have a conscious thought, I'm like running down the street. But if I had paused a moment, my prefrontal cortex would get activated and be like, that's a stuffed dog. I don't need to run away. Right? Does that make sense? Yeah?
So my question is, how does the insula link up with the frontal cortex and the amygdala? What's the connection or what's the link?
Yeah.
And how does it work in a mindfulness meditation?
That's a good question. So it's actually different in beginner meditators and people who've been practicing longer. It's very interesting to me anyway. I don't know if to others. So in beginner meditators, we see less activity with the insula and more of the prefrontal cortex getting involved, and we call it top-down regulation. So we're learning how to manage our emotions and manage that sort of hyperreactivity using our prefrontal cortex, right? But as we continue to practice and you get a little bit more distance from your emotions and thoughts in the sense that you can allow them to come without taking them too personally, you just let them come and go, right? They just come. Then you don't actually need to engage that so much. You don't need to control your experience so much. And you just have more of a body awareness right? So you can feel the fear response coming, amygdala is activated, oh look, there's the body tension coming, and then you just watch it and then it passes, right? So you don't engage in it more. So you don't need to use the prefrontal cortex so much. It's just observing, observing, observing. Does that answer your question?
Yes. How about the amygdala?
Sorry?
Amygdala, how does that link up?
How does the amygdala
Link up with the insula?
with the insula? It's a good question. To be honest, I don't exactly know all the neural pathways, but I know that the amygdala will create physical sensations in the body, right? Because it's releasing our stress hormones, and so we're going to be feeling that. So there definitely is a linkage between those two. And also what can happen is when we feel stress hormones in our body, sometimes our mind interprets that, our amygdala interprets that as meaning something is wrong. Does this make sense?
Yes.
So we feel stress in the body. Our mind says, well, that must mean something is wrong. So let's give an example. I see the stuffed dog. Because a dog bit me before, I have a reaction in the body that's fear. I think that, you know, the body is like, my amygdala is interpreting the stuffed dog as a threat. So I feel fear, I feel stress in the body. And then because I feel stress in the body, my amygdala further tells me, well, there really must be something wrong. I better, you know, get out of here even faster because the situation is just going nowhere good. Do you see what I mean? So we can kind of like magnify the problem because we interpret our physical sensations in a negative way. Does that make sense?
Sure.
Yeah. Okay. Okay, so that emotional regulation, and we'll go to the next slide. Yeah, so the last thing I didn't talk about was this one here, these two. So with the practice, we also have changes in our perspective on ourselves. So this is where we gain insight into this selfing process. And as we start to see how the self stories come and go, our sense of self can shift a little bit. We might be a little bit less rigid in our views about the world or in our views about ourselves or in the ways that we think we're allowed to be in the world. And so this can be very liberating and very freeing for a lot of people. It can also be scary. So I'm going to talk about that a bit more later, right? When we change our sense of self, it can be a bit of a scary process. But it's has the potential to be very freeing too, when we don't feel so stuck. And as I mentioned before, we see increases in compassion towards ourselves and others when we can accept our experience, our internal experience, and therefore other internal experiences, other people's internal experience. Because we know this is just my conditioning, right? These are the neural circuits I've got. It's because of my life. And that's the, you know, conditioning they've got because of their life and their lived experience. So we've just got conditioning and conditioning interacting with each other, if that makes sense. Yeah. Mm-hmm.
So how often do you have to practice? All day long time to get stressed or periodically or?
Right. Good question. Yeah. So the question was, how often do we have to practice this to find the benefits? And there isn't consensus in the research at this time. All the different studies have been doing interventions with different amounts of practice, and you know, certain amounts maybe people are asked to practice, but whether they actually do that or not is another thing, right? So generally, you know, we could say 20 minutes a day is good. Often when people are first starting, you might just start with 5 minutes and keep it simple and not overwhelm yourself, and then you can gradually increase it. I mean, for myself, I spend a lot more time than that in my practice, and the more that you practice, the more you'll gain insight, right? So at least up to 45 minutes, I think there's still like incremental gain, and after that, we see. Yeah. Mm-hmm.
Would it be valid though to broaden what you're defining as mindfulness? Like if I spend 30 minutes on my bicycle and I'm keeping my heart rate going and I'm focused, am I practicing mindfulness?
So you might be practicing being mindful, right? You're aware, you're being aware of your heart rate, you're being aware of yourself pedaling. Is that Am I
Yes.
understanding that right?
And I'm in the moment.
You're in the moment, yeah,
And I've got my heart rate calm,
yeah,
and I've gotten rid of my other thoughts
yeah.
by being on that bicycle. Am I practicing mindfulness?
Yeah, so yes, and there's lots of different ways in our groups. We get people to do all kinds of other activities mindfully besides just sitting. But the one thing where we often get caught is in thinking, well, my mind has to be quiet if I'm practicing mindfulness. And actually, the deeper understandings come when we look not at whether the mind is quiet or not, but at the process of the mind and how it creates a sense of ourself. Does that make sense? So it's a bit hard to kind of grasp that part. Mm-hmm.
You're just going to be saying you're riding your bike and listening to a meditation tape that does double duty.
So the comment was, if you're riding a bike and listening to a meditation tape, you're doing double duty. I actually think riding the bike and just listening to yourself would probably be a very wonderful mindfulness activity to do. Yeah, absolutely. And different people will access, places of calm and wisdom and insight in different ways. So there's no one way you have to do it, but this particular process can give us an insight into the nature of who we think we are, which is a very powerful thing when we're dealing with looking at, existential questions.
I have a question. Sometimes you said it's flee or fight, but what if you freeze and you're panicking and
Yeah.
you can't even muster a thought?
Yeah.
How do you help yourself?
Fight, flight, or freeze. The question is, what if you panic and you freeze, and it's not fight or flight, it's just a freeze? I'm actually going to get to that soon.
Okay.
Yeah. So maybe let's go to the next slide. This is exactly what we're going to talk about. So myth number 5, every moment is a good moment to practice mindfulness. So not true. Let's go to the next slide. I like this cartoon. Jack would later be charged with premeditated murder. Okay. So let's go to the next slide. So there's the freeze response coming in. And this is a chart. You can press it. We've already sort of talked about this. So our sympathetic nervous system causes the flight, fight, or freeze response. And I add freeze in here now to go into more of the nuances about it. And there's certain times when that's activated that it's not a good time to practice mindfulness. So we'll go to the next slide. So we call this a window of tolerance, this area here. And it's important to understand what this window of tolerance is, because sometimes we're outside of our window of tolerance and we're like in freeze mode and our mind has gone blank, or we're so agitated, so full of rage, or so scared that our mind is just like, whoosh. I mean, everybody's probably had that experience at some point in their life where you just cannot think clearly. That's not really the right time to sit and do a mindfulness practice. That's when you would want to call a friend, or, go out for a walk in nature, or sometimes really simple grounding things you can do is just like push on a wall, or press your feet into the floor, tap your body, right? Just like get yourself back here and now, grounded in your body. Yeah. So if you try and sit and do the mindfulness and you're frozen and your mind's blank, it's not helpful. It can actually be re-traumatizing. So it's important to ground yourself first and then get into your window of tolerance and then practice. And similarly, sometimes we go from hyper-arousal to hypo-arousal. Like it's just so much that we shut down, right? We go numb, depressed, feelings like shame might come up, totally disconnected from the world. That's also not, if it's really severe, that's not the best time to practice mindfulness either. Then you might want to do, some vigorous exercise, or again, connect with someone you love and feel supported by, or talk to an individual counselor or support person. Because if you're really down, you may just be sitting there reinforcing things that are very painful, and that's not helpful. So the window of tolerance is kind of in the middle. It's not comfortable all the time, right? We'll still be uncomfortable within our window of tolerance, but we have our prefrontal cortex online, so we can still engage that part. And then with the mindfulness practice, what we're actually doing is expanding our window of tolerance and slowly being able to absorb and be with more uncomfortable experiences. That could be mental, physical, or otherwise. Do people understand that? Any questions? Okay, next one. Okay, mindfulness is a quick and easy fix, so this kind of speaks to your... So this is another myth that we sometimes see, like somebody looking very happy and sitting in meditation. It's not quite like that. Next slide. So what we've seen is that you can get benefits, and those even show up in the neuroimaging within 6 to 8 weeks of doing a mindfulness group. But those benefits are not necessarily sustained, so you have to keep practicing. However, in the cancer research, they have shown sustained benefits, so I'm not sure why that is. It could be perhaps that people have insights that help them to sustain a sense of well-being from their practice. That happens more in a cancer population than in a regular population. I don't know. So everyone will be a bit different in terms of how often and how long they need to practice for, but I would say you just keep going. It's a bit of a commitment. All right, next one. Okay, so adverse effects of mindfulness. I want to address this. It's not really been researched. You don't see it in the publications, but for those of us who have practiced a lot, we know about this because we've experienced it ourselves and we've seen it in the people we work with. So our sense of self can change, as I mentioned before, and that can be really scary at times. So when we're going into a place of the unknown, it can bring up a lot of fear. So it's important for you to be aware of that, and if you're doing a mindfulness practice seriously, to get a guide who understands that and can help support you through some of those periods of transition. Also, past traumatic memories can resurface. So difficult experiences we may have had in the past may start to surface as we get more relaxed. For some people, those things are on the surface already, but for other people, they may practice for some years and then things start to surface. And again, it's nice to be able to get support and to know how to navigate that in a skillful way, which is why having a good teacher, facilitator, or guide is important, I would say. Okay, next one. So how to find a skilled facilitator or teacher. We're very lucky in Toronto that there are so many people now who teach. Some of them are skilled and some of them are not. And this is important to be aware of because some of them may have just done like, an 8-week training program and then are teaching it. Whereas, people who you might want to work with, should probably have been practicing for at least 10 or 15 years themselves, every day. And that's the kind of facilitator I would suggest people get because they will know the ins and outs of the practice, they will know the pitfalls, and they will know how to help you get through that. I would say to find someone who has a system of ethics. It doesn't matter if it's secular or if it's part of a spiritual or religious tradition. But, you could use mindfulness to become a better bank robber, right? Let me just get some better concentration so I can figure out how to get in there, right? So that's not what we're looking for. So you want to have someone who has a solid, ethical foundation for their practice. And then you might want to be curious about finding someone who has an understanding of the spiritual dimensions that can come up, because it can happen, right? That you're sitting there practicing and all of a sudden you drop into a different state of consciousness and it's like, oh, well, what was that? And who can I talk to about it? And it can be a bit confusing. So, I was talking to a friend of mine who's a mindfulness teacher, and she went to a training session at Google for mindfulness in business. And so they were teaching people meditation, and it was like the first time for most of the people there. And they did a 10-minute meditation, and someone, put their hand up and said, well, I was having this experience, and what was that? So you want to be able to have a guide who can guide you through those things if it comes up. So that's a few things that I would encourage you to keep in mind if you're going to practice. All right, so summary. Actually, before the summary. So I've given you a list of resources. So if people are interested in doing some mindfulness for themselves, there's some really great resources in Toronto. Tons of them. And so I put a couple, I've got my own there, and then a couple near the top on that page are Gilda's Club, which has the person who facilitates the group there is wonderful. So that's a really great cancer-specific resource, and for family members of people with cancer. And then there's also at Princess Margaret Hospital, the Healing Journey, I think it's through Wellspring, and they have some mindfulness classes and programs there as well, which are cancer-specific. And then there's a bunch of physicians like myself who do mindfulness workshops and trainings in the city who are quite good. So they're listed. And then there's hospital programs. They're a bit more variable, I think, in terms of what you'll get. But there are some good hospital programs as well. And then after that, I've listed some Buddhist, Muslim, Christian, and Jewish mindfulness resources. So if you want to connect to the practice in a different faith tradition and you have a faith tradition that's important to you, that could be another option to explore. So, any questions about that? Yeah?
In your case, do you have to be referred to your clinic after the physician, or is it walking to your
Yeah. So for me, I don't, because the question was, do you need to be referred to me by a family physician, or can people just come? Because I'm a family physician myself, I don't need a referral from a family doctor. I have a website, and you can just go onto my website. It's www.heartspace.ca, and send a message from there saying you'd like to register for the next groups. And then I have an intake process to make sure that it's a good fit for your needs. And if it is, then you could participate. Yeah. Yeah, my next groups are starting in September, so I'll be doing registration very soon. Yeah. Yeah, any other questions about resources? Mm-hmm.
Any particular apps that you like?
Apps. So any particular apps that I like? Yeah, so Headspace is very popular. There's a lot of people in my groups who like using Headspace. That's one, actually the person I was just reading the other day who developed it was trained as a monk for many years and then developed this app. And it just has a short 10-minute meditation, so some people like that. The other one that people have quite liked is called Insight Timer. And Insight Timer has a timer, so you can time how long you want to practice for, and then it dings like any timer, but it sounds like a gong when you're done. But the other thing it has is it has a lot of guided meditations. It has like thousands of different guided meditations. Some of those guided meditations are excellent. Some of them, I would say, are of lesser quality. So you need to use a little bit of judgment with that. But it also has like social networking and stuff like that within the app, so that you can see like, oh, I'm meditating with 300,000 other people right now. And you kind of feel like you're part of a community. So some people like that one.
What's it called?
Insight Timer. Yeah. Yeah. Any other resource questions? Mm-hmm.
Is yoga an alternative to this or similar to it?
Mm-hmm. That's a good question. The question is yoga an alternative to this or similar to this? It's similar and different. I use yoga in my groups as a way of helping people to ground. So helping people to go from being out of their window of tolerance to in their window of tolerance. It's very helpful. It can be very relaxing. And I would say it has more relaxation training component, whereas the mindfulness practice sometimes is relaxing, but sometimes isn't. Yeah, so yoga is very helpful as an adjunct, I would say, and I include it in my groups for that reason. Mm-hmm. Yeah. Also, other resources online, there's amazing talks by different spiritual teachers, so if you're interested in that dimension of it, you can find thousands of excellent talks online. I have some resources on my website connected to that for people who want to pursue that direction further as well. Yeah. Okay, so just to summarize, mindfulness meditation can be a helpful tool for improving attention, learning emotion self-regulation, and developing a more accepting attitude towards yourself and towards life. It's been shown in cancer patients to improve mood, reduce anxiety, and improve the quality of life and people's spirituality. There are many resources that you can access online, and especially in Toronto, you can access in person. They're free of charge, a lot of them, so that's really nice. But it's important to find a guide that you feel comfortable with and who's skillful. And more research is needed. It's definitely like in its infancy in terms of the research. Okay, last slide. So just like to acknowledge and thank the Toronto and District Multiple Myeloma Support Group for having me here. It was really, I'm so grateful and it's such a pleasure. Yeah.